thinking like an outlier means that you understand that economic cycles are up and down, but you look outside of medicine, for example, and look at the best companies across many, many industries. They tend to do well regardless of what's going on in the economy. Why? Because they are just so ruthlessly focused on making the customer experience exceptional, in addition to having great products and services. The Outliers meeting is now in its 4th year, and the reason it is picking up so much momentum, as doctors attending for the first time are telling me, is that it's addressing issues that don't get discussed in the large format meetings. There's a strong focus on patient experience. Another focus is on advanced technology, and then third, profitability. Those are topics that don't get much airtime at the AAO or the ASCRS. So now we have a specialized forum where you are hearing the best pearls possible in terms of what you can apply in your practice. An outlier practice is one that says we want to stand out in our community for being the best. And we're going to do that through how we treat the patient, not just clinically, but experientially. We're going to do it by making sure, yes, of course, we use advanced technology, and then we're going to have a focus on profitability to make sure that we are sustainable and that we can keep delivering that outstanding service and delighting our patients. Traditionally, doctors have had a fairly standard definition of what made their practices successful. It was great patient care through great clinical outcomes. But in the modern era, that's not enough. Great clinical outcomes are expected. You need to have the system and the structure to support your team so that you can actually thrive in this new era where the demands of the consumer are just increasing all the time. You can't have a great patient experience without a great team. And you really need to feed and nurture your team so that they understand their role. Most doctors are either doing consults or doing surgery. They're not out in the clinic. And in fact, they spend less time with the patient than their team members do by far. So we want to make sure that team members not only understand the importance, but can really contribute to what this patient experience can be like in a practice. It's absolutely possible. And now with the PX90 program, we make it accessible for you.